was on polycystic ovarian syndrome. So, polycystic ovary syndrome is a problem with hormones that happens during reproductive years. So, if you have this, you might not have periods very often, or you may have periods that last many days. You can also have too much of a hormone called androgen in your body. So when you have PCOS, many small sacs of fluid develop along the outer edge of the ovary, and these are called cysts. The small fluid cysts contain immature eggs. These are called follicles. The follicles fail to regularly release eggs. So the exact cause of PCOS is unknown. However, early diagnosis and treatment along with weight loss can lower the risk of long-term complications such as type 2 diabetes and heart disease. So symptoms of PCOS often start around the time of the first menstrual period. So these symptoms develop later after you had periods for a while. So these symptoms do vary. A diagnosis of PCOS is made when you have two of these. Irregular periods. So having through your menstrual periods or having periods that aren't regular or common signs of PCOS. So is having periods that last for many days or longer than is typical for a period. For example, you might have fewer than 9 periods a year, and those periods may occur 35 days apart. You can have trouble getting pregnant. You can also have too much androgen. So high levels of the hormone androgen can result in excess facial and body hair. This is called hirsutism. Sometimes severe acne and male pattern baldness can happen too. You have polycystic ovaries, so your ovaries can be bigger. Many follicles containing immature eggs may develop around the edge of the ovary. The ovaries might not work the way they should. So PCOS symptoms are typically more severe in people with obesity. So the exact cause of PCOS isn't known. Factors that can play a role include insulin resistance. So insulin is a hormone that the pancreas makes. It allows cells to use sugar, your body's primary energy supplies. If cells become resistant to the action of insulin, then blood sugar levels can go up. This can cause your body to make more insulin and try and bring down the blood sugar level. Too much insulin can cause your body to make too much of the male hormone androgen. You can have trouble with ovulation, a process where eggs are released from the ovary. One sign of insulin resistance is dark, velvety patches of skin on the lower part of the neck, armpits, groin, or under the breasts. A bigger appetite and weight gain can be other signs. You can have low-grade inflammation. So white blood cells make substances in response to infection or injury. So this response is called low-grade inflammation. So research has shown that people with PCOS have a long-time type of low-grade inflammation that leads to polycystic ovaries to produce androgens. This can lead to heart and blood vessel problems. Heredity. So research has also shown that certain genes can be linked to PCOS. So having a family history of this can play a role in developing a condition. You can also have excess androgen. So with PCOS, the ovaries can produce high levels of androgen. Having too much androgen interferes with ovulations. This means that eggs don't develop on a regular basis and aren't released from the follicles where they develop. Excess androgen can also result in hirsutism and acne, as I mentioned in the previous slide. So complications can include infertility, gestational diabetes or pregnancy-induced high blood pressure, miscarriage or premature birth, non-alcoholic steatohepatitis, which is severe inflammation liver inflammation caused by fat buildup in the liver, metabolic syndrome. So these are a cluster of conditions including high blood pressure, high blood sugar and unhealthy cholesterol or triglyceride levels that significantly increase your risk of heart and blood vessel. You can have type 2 diabetes or pre-diabetes. You can have sleep apnea, depression, anxiety, eating disorders. You can have cancer of the uterine lining, also known as endometrial cancer. You can have obesity, commonly occurs with PCOS and can worsen complications of the disorder. So, for diagnosis of PCOS, there's no single test to specifically diagnose polycystic ovarian syndrome. So, obviously, your symptoms, your medications, and any other medical conditions will be discussed. You can also be asked about your menstrual periods and any weight changes. A physical exam will take place, including checking for signs of excess hair, growth, insulin resistance, and acne. So you might end up with a pelvic exam. During this, your reproductive organs will be checked for masses, growths, or other changes. Blood tests to measure hormone levels. So this can exclude possible causes of menstrual problems or androgen excess that mimic PCOS. You might have other blood testing, such as fasting cholesterol and triglyceride levels. A glucose tolerance test can also measure your blood's response to glucose. An ultrasound to check the appearance of your ovaries and the thickness of the lining of the uterus. A transducer is basically placed in your vagina. The transducer emits sound waves that are translated into images on a computer screen. So If you do end up with a diagnosis of PCOS, you can end up having regular checks on blood pressure, glucose tolerance, and cholesterol triglyceride levels, screening for depression and anxiety, and obstructive sleep apnea. So treatment is basically focused on things that are concerning you. So this include infertility, hirsutism, acne, obesity. So you might end up with lifestyle changes or medication. So in regards firstly to lifestyle changes, you can have weight loss programs for a low calorie diet, exercise with moderate exercise activities. So losing 5% of your body weight can improve your condition, and it can also increase the it can also increase the effectiveness of medications and help with infertility. You can have a combination of birth control pills, so pills that contain both estrogen and progesterone, decrease androgen production and regulate estrogen. Regulating your hormones can lower your risk of endometrial cancer and correct irregular bleeding, excess hair growth, and acne. You can have progesterone therapy, so taking it for 10 to 14 days every 1 to 2 months can regulate your periods and protect against endometrial cancer. This doesn't improve the androgen levels and won't prevent pregnancy. So if it's only the mini pill and it contains the intrauterine device, this is a better choice if you wish to avoid pregnancy. So to help you ovulate, so you can become pregnant, you can end up having prescribed clomiphene. This is an oral anti-estrogen medication taken during the first part of your menstrual cycle. Letrozole, which is the breast cancer, can work to stimulate the ovaries. Metformin, this is a medicine for type 2 diabetes that improves insulin resistance and lowers insulin levels. If you don't become pregnant using clomiphene, your provider can recommend adding metformin to help you ovulate. If you have pre-diabetes, metformin can slow the progression of type 2 diabetes and help with weight loss. Gonadotrophins, so these hormone medications are given by injection. So if you are looking at becoming pregnant, you can have in vitro fertilization to reduce excessive hair growth and improve acne. You can have birth control pills. These pills decrease androgen production that can cause excessive hair growth and acne. You can have a medicine called spironolactone, also known as aldactone. So this medication blocks the effects of androgen on the skin, including excess hair growth and acne. But it has caused birth defects, so effective birth control is needed while taking this medication. So if you want to become pregnant, or if you are, don't take this medication. You can have effloinine. So this is a cream that can slow facial hair growth. You can also have hair removal done. So electrolysis and laser hair removal are two options for removing hair. So the electrolysis uses a tiny needle inserted into each hair follicle. The needle sends out a pulse of electric current. Current damages and destroys the follicle. You can have laser hair removal, which is a concentrated beam of light to reduce unwanted hair. But you will need multiple treatments of this if you are taking this option, such as laser hair removal or electrolysis. You can also have shaving, plucking, or using cream that dissolves unwanted hair, but these are temporary and the hair can thicken when it grows back. For acne treatments, you can have medications including pills and topical creams or gels. And as I said before about lifestyle and home remedies, so stay at a healthy weight. Weight can reduce your insulin and androgen levels and it can restore ovulation. Limit your carbohydrates so your insulin levels don't go higher. And exercise, which will help keep your weight under control. That's the end of today's video, so thank you very much for tuning in, and I look forward to seeing you at the next one. Thank you, bye bye.